The interplay between ambulance and police, we both have quite distinct functions, but the police come for a reason. The police, when we're involved, police are being rung for a particular reason. And often it's around allegations of criminal offences. There's perhaps an element of safety in there as well. And there's also welfare-related matters. So from the panel discussion today, I think police are often criticised for their response. But what I'd like to think is that people now have a better understanding that we are an organisation that's just not keep doing things the same way. We're receptive to changing our way we respond, and it's important we do keep changing that, because this is a very complex environment, and people that are suffering dementia can be a victim, they can be a witness. In both regards, they're very vulnerable, and then in some respects they can also be an offender, which again makes the whole complexity of this just so difficult. And we're the providers of a criminal justice support, and so police are looked upon to respond in a certain way. And I made the comment during the panel discussion that if the police can't safely resolve something, who's next? So often we're caught in difficult situations. Our police are trained to respond. It's not always that we get it right, but we do learn from experience. And I think today's discussion, again, that whole lived experience that comes out where people have those poor experiences with police, we do change the way we behave. The training's telling them is don't focus yourself on a particular resolution process. I think if you walk into an aged care facility, you're automatically walking into an environment where just the sheer age demographic would say these people are not physically capable of doing something that a 20 or 30-year-old could do. So they may be physically constrained. They will have mood swings that perhaps aren't reflective of their normal behaviour. But the first instance, the reason we've been called, the police then are expected to do something. So going through their mind, and I think there's been past experiences where there haven't been great outcomes. They're the things that police agencies reflect on, and sitting in the back of the mind of any police officer going to this job, and they talk on their way there, they talk about the circumstance they're going into, but sending police into an aged care environment to resolve something is probably not something that sits quite comfortably with the police. Using a use of force option against an elderly patient is absolutely not in the first mind or first front of mind for how police are going to safely resolve something when we've been called for a particular reason.
Yeah.